my pleasure to welcome you to an interactive session on myths and reality of gastroenterology and healthy lifestyle for women. A discussion on recognizing potential causes, preventive care, and myths coincided with art of medicine related to alimentary canal, acidity, and gas issues. Dr. Reddy, thank you for being with us. We look forward to an enriching and inspiring session. Thank you so much.
And for giving us this opportunity to be here this evening. Healthy living involves doing things that enhances your quality of life. So the reason why we die, of course, first is accidents, including earthquakes. In fact, this is very interesting that if you look at all over statistics all over the world, women live longer than men. In more advanced countries, for example, they live 10 years longer than men. And even in India, if you see, in general, these are general statistics, they're 5 years longer than men, average age of death. So they live longer. This is because, again, genes, the way we actually prolong life in human race as such over all these years is because of conquering infective diseases. And I'll show you an example of this. This recent Ebola virus you've been reading in the papers, a lot of Ebola virus coming. There were scientists working at least in 70 countries looking very closely at the Ebola virus. They actually completely sequenced the whole gene of the virus. They knew how the virus grows. Then they're trying to work at various antibiotics to try and kill the virus. But in spite of all this, the virus started proliferating. It was actually taking over many countries. But what you now know is everything is controlled by simple technique. The control was they isolated the patients having this Ebola virus infection completely. The one thing that I think we've been able to actually make a difference is in patients with cancer. These are statistics again from WHO that what are the cause of deaths in our country. You'll find that cancer deaths because of either gastric cancer, liver cancer or colon cancer is one of the leading causes. Clearly one of the areas we've shown that you can actually prevent a disease, prevent colon cancer, because we know of several, I think some of you here also have had incidences where friends or known people have suddenly come up with colon cancer, terminal stage, nothing can be done and they die. But these are something that could have been prevented easily if at least those in whom have a family history of colon cancer, families of other cancers should get themselves colonoscoped at least to prevent this. So right now we don't have, once you have an advanced cancer, we don't have methods to cure the patient, but we can actually prevent many of these gastrointestinal tract cancers are open to investigations and many of them can be prevented. So then we come to the last area in biovidia is iatrogenic. This may be a small number, but actually if you look at actual numbers, it's not so small. In the United States last year, 80,000 patients died because of negligence in the hospital. So therefore this issue has become, so we have to balance very carefully. We have to know that with the patient with a cardiac problem, we should not give these COX-2 painkillers. With somebody who has a tendency to bleed, we should not give the regular NSAIDs. So it's a big balance. So we have dilemmas in diagnosis, we have dilemmas in treating these patients. So this is called perfection without practice, which is very difficult. So what we do is we carefully mentor our people. For example, we now have training systems like this, where we have animal tissue or we have computers. We carefully mentor our doctors. Medicine is art, science, and empathy. And when you combine all this, we become the right doctors. The hands that help are holier than the lips that pray. And finally, it's a team effort that is very important. And you can see that at the Asian Institute of Gastroenterology, actually we have a wonderful group of colleagues working together. They actually do all the work and I get the credit. Thank you.
Dr. Rupa Banerjee to please address.
Good afternoon, everybody. I must begin by thanking Rekha for giving me the opportunity. Something very simple, acidity and gas, which we deal with daily, in, out, as a gastroenterologist. Now, gastric acidity and reflux actually affects people of all ages, all races, all genders. In fact, heartburn in India, at least 4 to 7% have heartburn daily. The stomach has the acid, and this is coming up to create a reflux or irritating the food pipe. And then what happens as a result? The symptoms. There is first and foremost the heartburn. Acidity can happen in children also. And these are children who have more vomiting, little coughing, sometimes breathing problems. So wrong diets obesity, stress, they get together and create acid reflux disease. So the key messages today, I would say, is acid reflux is a commonly occurring problem affecting the quality of life. It is a lifestyle disease. Simple medications can help, but lifestyle modifications are a must. But this is what we all need to know. Thank you.